Today, we are talking about a topic that has generated a lot of questions in the IMG community. Who actually qualifies for the new IMG pathways in the United States? There is a lot of information circulating online, and understandably, many internationally trained physicians are trying to figure it out whether these new actions could apply to them. These pathways represent real opportunities, but they are structured and state specific. They don't automatically replace resident, and they aren't designed for every situation. Organizations like the Federation of State Medical Boards has been tracking which states has enacted or proposed alternative pathways for international training physicians. However, eligibility depends on clearly defined criteria that depends by the states. So in this video, we are going to break down who might qualify, who might not, and what factors you should realistically consider before making any decisions. Section 1. Education requirements. First, you must be a fully trained physician. That means you graduate from a recognized international medical school, you hold a valid medical degree equivalent to ND or DO, your credentials can be verified. This is not for someone who didn't finish medical school, someone without formal medical training. In most cases, credential verification is still required, so this is for actual licensed physicians, not students. Section number 2, clinical experience. This is where many people misunderstand the policy. Most of these alternative pathways are designed for experienced physicians, doctors with several years of independent practice abroad, sometimes specialties with board certification in their home country. Many states require 3 to 5 years of recent active clinical practice, proof that you have been actively seeing patients. So I have seen, like, it depends of the state, but I have seen they ask you for a post-grade clinical training, aka resident. But if you don't have a resident, you need a certain amount of years of experience. That depends of each state. Section number 3, USMLE requirements. Do you still need USMLE? In many states, yes. Most alternative pathways still require a step 1, a step 2 CK, sometimes a step 3, even OET, occupational English test. So I have seen, like, it depends. Some states for the supervised license, which is like the temporal license, they ask you first step 1 and step 2, and also an English proficiency test, which is normally the OET is really used, to be honest. And then for the permanent license, you need a step 3, or they give you like a list of countries that if you have license from those countries and you have passed a test from, those countries that they have the list, you don't have to take a step 3. Or in some places they ask, we want, like, for the permanent license, you need to take a step 3, or some states, they are like, no, we need all USMLEs, step 1, step 2, step 3 for the limited license. So it depends, but in general, they ask for a step 1, a step 2, sometimes a step 3, and also an English proficiency test, which OET is commonly used and accepted, so it's okay. Section number 4, employment and supervision. This is extremely important. Using states like North Carolina as an example, through the North Carolina Medical Board, many of these licenses are employment based. That means you need a formal job offer. You must be employed by an approval healthcare organization. You practice under supervision. You might have scope limitations. This is usually not an independent, open your own clinic situation. This is a structured supervised practice. Section number 5, immigration. You must have a valid work authorization or an employer willing to sponsor a visa. These pathways does not override federal immigration law, so visa logistics still matter. Section number 6, who likely qualifies? Let's make it practical. You are more likely to qualify if you are an IMG with 5 to 10 years of active practice abroad, a specialist with documented clinical experience, a physician willing to work in a structured supervised settings, someone with complete USMLE exams. You are less likely to qualify if you are a recent graduate with no experience, someone without exam completion, someone seeking as soon as possible independent practice. And that's it for this video. Follow me on social media. I have the same username. Also follow me here on YouTube. Thank you for watching. Have a nice day. Bye.